Yep, let's go. We'll have over 1,000
right.
people, so let's do it. Yep, let's go ahead.
Excellent. All right. I hope you all have a wonderful event. And on that, we'll go
Thank you.
with 3, 2, 1.
Music hold ended.
Hello, I'm AARP Arizona State Director Dana Marie Kennedy, and I want to welcome you to this important discussion about the coronavirus. AARP Arizona is a nonprofit, nonpartisan organization with a membership. We have been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. As we begin to return to a somewhat normal way of life, we have the emergence of a BA2 variant that has rekindled concerns for many Americans as they prepare for the summer months. While increasing vaccination rates give us some comfort, we know that vaccine protection erodes over time, and some 100 million Americans who are eligible for booster shots haven't gotten them. Meanwhile, on the political front, Congress could be on the cusp of passing historic legislation that could finally lower drug costs for all Americans. Today, we'll hear from an impressive panel of experts about these issues and more, including Dr. Richard Carmona, the 17th U.S. Surgeon General and current advisor to Governor Doug Ducey at Arizona Department of Health Services, Carla Berg, MHS, Deputy Director for Public Health, Dr. Karen Lewis, Medical Director for the Immunization Program. If you've participated in one of these teletown halls before, you know this is similar to a radio talk show, and you have the opportunity to ask questions live. For those of you joining on the phone, if you would like to ask a question about the coronavirus pandemic, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. If you're joining us via Facebook stream, you can type in your question and comments, and we'll try our best to have the experts answer it. Hello, if you're just joining us, I'm Dana Kennedy with AARP, and I want to welcome you to this important discussion about the global coronavirus pandemic. We're talking with leading experts and taking questions live. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. We have some outstanding guests today. We'll also be joined by AARP colleague Alex Juarez, who will help facilitate questions and answers today. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff. Or if you're joining us on Facebook, place your questions in the comments. Now I would like to welcome our guests. We have Dr. Richard Carmona, the 17th Surgeon General of the United States and current advisor to Governor Doug Ducey and the Arizona Department of Health Services, Don Harrington, Arizona Department of Health Services Interim Director, and Carla Berg, MHS Deputy Director for Public Health, and Dr. Karen Lewis, Medical Director for the Immunization Program. Let's get started with the discussion. Just a reminder, to ask your questions, press *3 on your telephone keypad. Let's get started. Dr. Carmona, can you talk about where we are in Arizona with boosters and why the booster dose becomes a priority, and how effective are those vaccines against Omicron? Dr. Carmona.
Yes, thanks so much. It's a pleasure to be with you today, and I'd like to thank all of the AARP listeners for listening in, because we have made it a priority. To reach out to our seniors because that's a vulnerable population, and so we've done a lot of work in that. The other people I'd like to identify, though, my colleagues that are on the call with me that I've had the privilege to work with for quite some time now, and I couldn't think of a better team to take care of Arizona. So I want to thank them as well, because it's been a real privilege for me to work with them as well as the governor. Where we are as a state is as follows. We've got about 2 million cases in our state now. We've got about 29,000 plus deaths. And if we look at the numbers for vaccination, approximately 3/4 of the population has received at least one dose. And we have fully immunized, probably about 2/3 of the population. So what that tells you is there's still a significant amount of people that are not vaccinated. And of course, they are vulnerable. We are really proud of what we've been able to do with our senior population, which have very high vaccination rates. But that was because of the purposeful outreach. Director Harrington and the team got mobile teams going early on. We went to nursing homes. We went on the Indian reservations. We found out where the shut-ins were, and we made it a priority to identify the vulnerable population, especially fellow senior citizens who might have trouble getting a vaccination. So we feel good about that, but there's still a lot more work to be done because the virus is still circulating, and those who are not vaccinated are not only at risk for themselves, but they're at risk for getting really sick and transmitting it to other people, and it gives that virus much more time to be able to mutate and change into a new form, which could present problems in the future.
And a quick follow-up, Dr. Carmona, given the effectiveness of vaccines protecting against COVID or minimizing its severity, why do you think we haven't seen faster uptake on booster shots? And what's the message to millions who are eligible for a booster that need to hear that message?
Well, thanks so much for the question. This has been a learning period the last 2 years. Most citizens have become amateur epidemiologists and vaccinationologists and are using words they never had to use before. And people are afraid, under Don's direction and with the team with Carla and Karen and the rest of the team, we meet on a regular basis. You see the fear in people. They're not sure. Most people don't understand immunology. They don't understand what a vaccine is. They just know that they're supposed to take their children to get vaccines when they go to school or they get a tetanus shot. So it's extraordinarily complex. And, Don has been great in making sure that the team understands that we have to meet the people where we are. So where you see the delays, where you see what we call vaccine hesitancy, whether it's for a booster or vaccines in general, we were very thoughtful about it. We said, well, let's look at the groups. When you're dealing with the migrant population across the border where there's language and cultural differences, that's different than educated people who don't want to get a vaccine or a booster because they're afraid. So looking at each group, making sure we understand, listening to them, find out what their fears are, find out why they're resistant, and then we do everything we can to educate them and inspire them to get their vaccines. The governor's been great on that as well, supporting us, doing a PSA with me to encourage people to get vaccines and boosters. We're still falling short. And again, the last thing I'll say now is if you haven't been vaccinated, please get vaccinated. If you haven't gotten your boosters, please get your boosters, especially for seniors, because you're at very high risk at this point with the circulating virus.
Thank you, Dr. Carmona. And again, if you're just joining us, I'm Dana Kennedy, State Director with AARP Arizona. If you have a question you'd like to ask, please press *3 on your telephone keypad. And thank you. And I'd now like to turn it to Dr. Lewis. The COVID-19 virus continues to mutate, which is why we haven't seen variants like Delta and Omicron, and now BA2. Will the mutation continue indefinitely, and are more boosters likely? And will they be as routine as the flu vaccine?
Time will tell about the variants, the mutations. But history tells us, yes, COVID is going to keep on mutating. Good news is that the vaccines still help protect you against serious disease, hospitalization, and death, especially if you get boosters. So that's why it's so important. We are very fortunate to have scientists that are able to identify these new mutants, to keep up with them, and to test to see how well the vaccines are working, and to discuss and make changes to vaccines as necessary, and in the future to recommend additional doses as necessary. We've had to do that with influenza to keep up with it every year. I suspect we'll need to do something similar with COVID. But again, time will tell.
Great. Thank you so much, Dr. Lewis. And Director Harrington and Carla Berg, let's bring you into this conversation. Just a couple months ago, the CDC and Arizona Department of Health Services updated its guidance and also went to a weekly reporting schedule rather than a daily one. Where are we today?
Well, I'll try to handle that one, Dana. I think we've gone to a weekly schedule of reporting because that matches the way we do all diseases here in Arizona. I think those folks who are familiar with the stock market recognize that if they're invested in a stock, they don't watch the daily performance of the stock as it goes up and down. They look at the trend and it smooths out to see where things are really going. as a result, we're trying to do the same kind of concept with the disease to let people know where it's going and not have the daily fluctuations occur so that people might think one thing that might not actually be in the way of a trend. So we try to keep it simple for people and ourselves to look at and understand the direction of the disease. We've changed some of the reporting in terms of we're no longer collecting the emergency room data, but we're still collecting the inpatient beds and the ICU beds. And if you were to look at our website and see our dashboards, you can see that both of those are increasing in availability, which is, of course, a very good sign. So I think we'll add more or modify information as we deem necessary so that the public can stay informed.
Great, thank you so much. And I have a question for all of you. These are still confusing times, and public in general is burned out on COVID-19 news. We still have different rules for wearing masks. Businesses may have their own rules, and of course, it's impossible to know if someone you meet is vaccinated or not. How do people navigate everyday activities, even if they are fully vaccinated and boosted? Are some of the rules of thumb we should follow to safely dine out, travel, go to the theater, or enjoy family activities?
Well, I'll happy to start, and then my colleagues have the same information, but I'll get started with the conversation. I think what's important is to understand the degree of transmissibility, degree of presence in your community of the virus, and how fast it's going. Now, in the state of Arizona, we're pretty low right now, relatively speaking. We're doing a lot better. So therefore, you can consider relaxing. But then you must ask, well, if you're young and healthy and you decide not to wear your mask outside, should you wear a mask indoors in a crowded facility, for instance, okay? Or how about seniors who might want to attend a concert, okay? So the approach is very different, but I think the important thing is if you're a high-risk person and you're in a crowded area, you should consider wearing a mask, okay? And if you're healthy and you're in an outdoor area and you're hanging out with your friends and everybody's been vaccinated, you're probably more safe not to wear it. There's no absolute here. It's a relative risk-benefit analysis. But I think the thing that we all talk about at ADHS is, especially for vulnerable populations, transplant patients, people on steroids, people on cancer medication, seniors, you should wear a mask when you're outside of your immediate circle, like your family that you know is vaccinated. And even then, because they're outside and you have asymptomatic carriers, you still might want to wear a mask if you're at high risk. I think that's the general approach. I asked my colleagues to comment as well.
As an infectious disease physician, I would tell people there are several ways, proven ways to prevent infection. If it's a vaccine preventable disease, get all the vaccines. But respiratory illnesses like COVID, influenza spread in saliva. So stay away from other people's saliva. Ways to do that? Social distancing. Masks help to keep your saliva from going out and helps to keep other people's saliva from getting in your mouth. And so masks are good, social distancing is good, vaccines are all good. And wash your hands so you don't take your dirty hands up to your mouth or eyes.
Thanks. Carla,
anybody else have anything?
Well, yes, I'd just add one thing. I think it's not really much of an addition, but I think people need to feel comfortable. And if you, myself, I'm in the group that's at risk age-wise. And so when I'm out and I'm outdoors and not in a crowded setting, I don't wear a mask. But even though I'm fully vaccinated and have 2 boosters at this point, I will put a mask on in a crowded setting simply because I recognize there's always the potential. And that's what I would encourage people to do. That makes me comfortable, and I would encourage people to make those choices that they feel comfortable with, that they can protect their health.
Yep. Agreed.
Anything you want to add, Carla? We want to get you into this conversation too.
No, nothing else to add to that question, but thank you, Dana.
Okay, thank you. As a reminder To ask your question, please press *3. We're going to take your live question soon. One of the least discussed dimensions of COVID has been the settling, where it has had the greatest impact. Close to 200,000 nursing home residents and staff have died from the virus. That's about a quarter of the COVID deaths in the U.S. What has happened in nursing homes is a national disgrace. What can be done to stop this, and what are we doing in Arizona to avoid this again?
So I can kick off that question. As Dr. Carmona mentioned, in terms of Arizonan and public health, our mission and goal is to have outreach to all Arizonans and to meet individuals where they are. And a huge part of this component is in vaccination, distribution, availability, and access. At ADHS, we've had some really strong partnerships with our associations related to long-term care facilities. That includes the ACA, the Arizona Healthcare Association, Leading Age, and also a really strong partnership with the Health Services Advisory Group, or HSAG. And we've come together with really looking at what outreach and coordination could look like for vaccination strategies. In January, we held a town hall for long-term care facilities along with these associations, and we brought to the table an additional option to help support mobile vaccination strategy. So we've been engaging with mobile vaccinators throughout the state. We have vendors statewide who can support and identify where there may be gaps. This is an opportunity that we have for county health departments, workplaces, but also for our facilities, whether these be skilled nursing facilities, long-term care facilities, or assisted living facilities. And there's a very quick outreach that can be done to identify a need. The mobile vendor coordination is done very smoothly, usually within a week or two, and it really helps to bring to the facility vaccination for individuals. To date, we've been able to reach individuals. Over 100,000 shots have been administered through this specific mobile vaccination strategy, which we are very proud of. But the work will continue, and we'll continue to monitor and track where there may be opportunities. How do we increase boosters within these facilities, but also identify where there may be residents, staff, that could be available to have that outreach. This also is available for second boosters, and we're doing an outreach to all of those facilities that we first engaged with for initial boosters and initial vaccination, and identifying that 4-month schedule so that we can reach back out and make available these mobile vaccine strategies again. So again, a lot is a timing of when individuals are ready and available to make that decision to seek vaccination, but what we want to do is remove any possible barrier for them to access that.
Thank you so much for that information. And I just have a question, kind of a follow-up regarding our long-term care facilities. I know that there was a time when a lot of families wanted to be able to see their loved ones and weren't able to, and we developed policies to be able to get people in. We were actually the very first in the country to be able to reunite family members with loved ones in facilities. And are any of the facilities locking down if there's a case, or how are they managing that? Do you have information on that?
Karen, you want to take it as the ID specialist?
There's standard infection control protocols, and so the facilities have things to do. There's cases. They put the person in isolation. The staff that goes in to take care of them wears masks, wash their hands, make sure that people are immunized in the facility, vaccines, distance, wash hands. And that works in a long-term care facility as well as outside on the individual basis, as I've described.
I think
Great,
another important point to make is that this is our most vulnerable population, typically, that have chronic diseases on multiple medications, and many of them, in the last years of their life. And so when you think about when we first, this pandemic first exposed its ugly rearing head, it was in a nursing facility in the Northwest, where it spread rampantly and took a lot of lives. So as Karen said, We have to be, even more fastidious in those places. You'll remember some of the terms from the beginning for the amateur epidemiologist: contact tracing. As soon as you get a case, you want to know where'd that come from, okay? And you don't want to be sending people out with the disease either, because you can be what they call an asymptomatic carrier. You can carry the disease, carry it and go home and spread it to your grandma at home. So there's a rigorous process in place, as Karen said, to start that contact tracing right away, and essentially you shut down. You have to shut down for a while until you can make the determination, isolate the person. People have to start wearing personal protective gear once you have that it's circulating, until you're sure that there's no more disease there, and you don't inadvertently want to take it home to your family if you're a doctor, a nurse, or a healthcare worker within the facility. So those are real important questions, though, and I think we have a really great program, lots of smart people focusing on our vulnerable populations, including the nursing homes.
Great, thank you so much. So it's now time to address our callers' questions about the coronavirus vaccine booster with Dr. Carmona, Arizona Department of Health Service Director Don Harrington, Dr. Lewis, and Carla Berger. Please press *3 at any time on your telephone keypad to be connected with an AARP staff to share your question. I'd now like to bring Alex Juarez, our Communications Director, to help facilitate your calls. Welcome, Alex.
Thank you, Dana. And I'm thrilled to be among such distinguished guests and experts in the topic of this important conversation. So we're going to start. We have a lot of calls on the queue, and we have some questions also on Facebook. So I'm going to mix it up a little bit. We're going to try to go as fast as possible on as many questions as we can here to answer them. First, we're going to go to Phoenix, and we have Ralph. Ralph, can you hear us?
Yes, I can.
Go ahead, please.
Yeah, my question is there a test that will determine how effective the inoculations can be? Now, I'm 80 years old and I am immune compromised, and I had what was called an IgG test, and it showed, as far as antibodies, that it was non-reactive. So the doctor said apparently the vaccine had no effect. But then I've been reading that's not totally the case. Is there a test that will be more definitive?
Go ahead, Karen.
The antibody test has not been determined the level that is protective. You make antibodies against infection, but there are also cells that help fight against infection. The CDC recommends not doing blood tests on individuals. They did it in clinical trials. But on an individual, the most important thing is to get all of the recommended vaccines. So the first 3 primary vaccines and then the 2 boosters. And that will give you the best protection at the current time. And also infection control issues. Minimizing the people you're around, wearing a mask when you go out, hand washing, that's another level of protection. But blood testing is not recommended.
Thank you.
If I could just add to that, again, this is one of those confusing points, and I think it's worthwhile reiterating, because people read about the different tests and they want to know. When you say immunity, it's not a single number, as Karen said. There's cellular immunity, there's humoral immunity, there's different parts of immunity, and there's no one measure for them. Now, in a laboratory, researchers can measure those different things and determine how much of a bump you get when you get but it's not clinically applicable for the average person. So as Karen said, the important thing is we know the vaccines work. We know that even in immunocompromised patients, those transplant patients and others, they still get some benefit. It may not be as beneficial as a normal patient, but it's better than not doing it at all. And so there's a lot of reports coming out very strongly supportive of immunocompromised patients getting the vaccine. But I do understand how complicated it is when you get all these confusing messages about antibody tests and this PCR and and antigen testing, and you're not sure what to do. Let your docs determine what test you need, if you need a test. But as Karen said, get the vaccination. We know it works. Get your boosters because we know they work.
Thank you, Dr. Carmona and Dr. Lewis. Thank you for the question there for our caller. And we have a question on Facebook, and I think everybody wants to know the answer to this, given that the judge in Florida just gave on mask mandates. So the question is, how safe is it to fly now without a mask?
My understanding is that the air in airplanes is quite good, but you're crowded and close to people. You don't know who's been vaccinated. You don't know how good your immunity is. Personally, if I need to go on an airplane, I wear a mask and I keep it on, and I just try to keep my distance from other people as much as possible. It's a risk-benefit choice.
Yeah, I think it probably worthwhile making sure that this decision made by a judge is not interpreted to be medically derived. This was a decision based on understanding of law and the legality of the CDC having the ability to mandate a mask. Had nothing to do with if it's safe or not. So everything we said still stands as far as masking in the appropriate settings. That's a legal issue that the CDC is going to have to deal with, and they may challenge it. They may feel that judge was incorrect, and they'll take it to the next level. In the meantime, I think all of our directions thus far have merit and should be followed.
Great point, Dr. Carmona. Thank you so much for the reply. We're going to go down south in Arizona, in Tombstone, and we have Carol. Carol, can you hear us?
Yes, I can.
Go ahead, Carol.
I'm here. Oh, my question
go ahead
is,
with the question.
my husband and I are both in our 80s, very healthy, and we've done very well. We've had the first 3 shots, and I was wondering where, and if it's necessary, we get the 4th shot. And also, I heard the 4th shot costs $76 per shot.
No.
That is totally incorrect. There is no charge for the COVID vaccine. You get it in pharmacies. It's important for somebody over 50, especially over 65, to consider getting that second booster dose. So you've gotten the 3 doses. I assume you're not immunocompromised. You're healthy. Get that 4th dose. I just did it last Saturday. And the pharmacy was very easy for me, I was able to easily schedule it.
Thank you. That's good.
Thank you so much for your question. We appreciate your question there. Another question that came in from Facebook is they've already had 2 vaccine shots, booster shot. Do I need to get a booster every year like the flu shot is the question.
Good question. Okay, I'll start. And the answer was we don't know for sure yet. What we do know is that at about 5-6 months, your immunity starts to drop off. And you shouldn't take that as it's not effective and there's a lot of misinformation. Think about your children when they get their vaccines, starting in the first year of life. And then they come back and they get a booster. And then they get another booster. Depending on what the pathogen or germ is, there's different sequencing of what vaccines there are needed. Tetanus, smallpox, whooping cough, measles, mumps, rubella, all of those things are different. So here we are just learning about this virus over the last 2+ years. It's brand new. So our scientists are gathering information, and what they found out, much to their credit early on, is that first vaccine did help you, but then it starts to drop at about a few months. Okay, then so, well, now you need a booster. Now people took that, and here's where the misinformation. Well, see, they really didn't know what they were doing because now they're asking us to get another one. No, that's not it. In fact, the information is fresh, and as it's coming and they aggregate thousands of people, they see, this is starting to drop, so now we recommend you get another shot. And with that second shot, the same thing happened. So now we see over time, it's looking like it's lasting 5-6 months. So as Karen said earlier, it's more than likely that you will get a vaccine every year, but it could be included in the flu vaccine, and that's some of the research that's going on now to try and wrap it all into one. But the good news is we semi-solved this problem. We understand we have to do it rapidly so that it doesn't mutate as much. And wherever you are in the scale, going from the initial to the 3rd or the 4th, I wouldn't be surprised that as this goes on, if then we had another booster in 5 or 6 months if we still have transmissibility and circulating virus. But rest assured, the scientists are working on this to figure out, can they do something that would let it last for a year, just like we have many of our other vaccines.
Thank you so much, Dr. Carmona.
Mm-hmm.
Go ahead.
I was going to say the scientists are working on the vaccines. The epidemiologists are studying the virus. The CDC just had a very large meeting today to discuss the issues of what do we do with boosters? How can we help protect people in the best way? So just listen to the public health recommendations, and that would be the communication from the recommendations of the scientific experts.
Wonderful. Thank you so much, Dr. Lewis. We're going to go to Avondale. In Avondale, we have, is it Lorraine?
Yes.
Go ahead, please, with your question.
My question is this. I am a retired registered nurse. I have 4 daughters that are all medical. 2 are fully vaccinated. I am fully vaccinated except for my last booster. 2 of them will not get vaccinated because they said that they were just perfectly safe and everything with their antibodies. Well, they've both had it twice, and they're sick now. So is it safer with the antibodies coming from natural disease or from the vaccine? And should I be even around them?
You should not be around them while they're sick if you can keep your distance.
They're out of state.
Okay. That's real good social distancing.
Yeah.
But it seems that the combination of infection and vaccines gives excellent immunity. And so even though they'd had infection a couple of times, the immunity from infection will wear off. That's what coronaviruses do, the things that cause the common colds, the immunity wears off even from that. So, getting back to this, you've had the illness, getting the vaccines as recommended actually gives you super immunity and protects you longer.
I thank you for that, but some children, mothers don't know anything.
When I worked in the hospital as an infectious disease doctor, I would think, wait, I'm earning my money because of infectious diseases, and people don't want to listen to me about vaccines.
Mm-hmm.
Well, get the shots, make me happy. Don't get the shots, make me rich. I'd rather be happy than rich, but okay.
Well, what's really lucky? These kids were here like 10, 11, 12 days ago, and they came down with it 2 days ago. And I thought, well, I was never hugging and kissing or anything because I'm still careful on that. Yeah. But they got it probably because they work, probably at work or in the airplane. Probably, But I thank you so much for clearing that up.
Wonderful.
We appreciate your
You're
question,
right,
Lorraine.
Mom.
Thank you so much. That is correct. Mom is always right there. Dr. Carmona, we have a question actually from Dr. Leonard Kirshner. He says, hello. Do you believe a COVID vaccine mandate is a good public health practice?
That's a very interesting question, and as you know, one that has been debated for some time. And I look at 2 sides. There are those that believe that mandate will increase the vaccination compliance, and yet there are those that believe what it does is to further entrench people who don't want it because they are individuals, and I'm an American, and you can't tell me what to do. So all of us on the team here have run into these discussions. And it's what I call the perils of a democracy. It's the right of the individual versus the collective right of society. And it's not that it's a right or wrong issue. It's, where do you want to spend your time? And so in our case in the state, when the legislature has decided that they didn't want mandates because they felt that people should make their own decisions, then we could spend time arguing that, or we can work around it and get everybody vaccinated, which is what we've done in the Department of Health Services and with the governor's support. And all of the outreach we did, all of the vaccines at the University of Arizona, we vaccinated 250,000 people. And yet there's still people with all of the things we're doing that because of misinformation, not understanding, or they just don't want the government to tell them what to do. And we try as best we can. But I don't think mandates would change that group. And I know under Don's leadership, we've had many discussions in the office and with Carla and her team and others. Let's look at this vaccine hesitancy, because if you try and treat it all as one, it doesn't make sense. But when we're dealing with migrants on the border who don't even know what a vaccine is, and yet they're essential employees because they get you your food, we got to keep them healthy. Then it's like you got to speak to them in language and culturally correct so that they understand what that means and they get a vaccine. Okay? When you have others that don't understand just because they're confused because there's so much misinformation on TV and on social media, and politicians that are canceling out each other's messages. So who do they believe? That's another problem. And then you have people that just feel, I don't want to do this no matter what you say because I'm an American and you can't tell me what to do. And that's another issue I discuss with my graduate students that, where does the right of the individual end when it is detrimental to the right of society? There's no right answer, but those are the things we have to work through in a democracy. But I appreciate the question from Dr. Kirshner. It's a very appropriate question, and one, believe me, all of my colleagues discuss on a daily basis.
Thank you, Dr. Carmona and Dr. Kirshner. Thank you so much for your question. We're going to go to Phoenix. We have Larry on the phone. Larry, can you hear us?
Yes, I can.
Go ahead, please, Larry.
Yes, I have been reading that the virus in 2020 or in 2022 is very much different than the virus in 2020. The virus in 2020, we all know what that virus did in terms of hospitalizations and deaths. And now in 2022, these new variants, the hospitalizations are down, the deaths are down. And so it seems like even though this virus is more infectious, more people are getting it, the outcomes are less traumatic with this new variant that is out there. Is what I said just true? And if it is, I have been reading that they're considering new ways of reporting this in terms of tracking hospitalizations and deaths versus reporting the number of cases. Is that something that you talk about?
Wow.
Director Harrington? Or?
Well, I can certainly start off. Thank you. Yes. I think, of course, the different variant does make a difference, and Dr. Carmona and Dr. Lewis can probably better address that. We know that the Omicron is less deadly, but more infectious, and I think that's a double-edged sword in that we're going to have more cases, and because of more cases, we'll end up getting more deaths potentially out of it. But as to the reporting, that wasn't really the reason we changed the reporting structure. The reporting structure was changed basically because the emergency was declared over, and we wanted to give people an overall viewpoint of hospital bed availability and ICU bed availability, knowing that if we were to get a spike in any one of the variants of COVID, that we would be able to track that also in that bed availability. So what we're trying to do is give a more overall picture to our hospital situation in terms of ICU beds and inpatient beds.
Excellent.
And
Thank you so much for the question.
The virus is different. It has multiple genetic mutations, and there's also more tools that we have with vaccines, with antivirals, monoclonal antibodies to keep people out of the hospital. So Omicron, in one sense, seems to be less serious. It's putting more kids in the hospital than the original virus did. And it's still killing people, 350 a day at the present time. So it still should be taken seriously. The vaccines work. You get that booster, and it really gives you about 80% protection against illness, but protection against hospitalization and death.
Can I just make just one more comment with what Karen said? Because the caller referenced what was happening in 2020 versus 22. So we've got 2 years. And so it's almost comparing apples and oranges, because when it started, nobody was vaccinated. We didn't have a vaccine. Then we got a vaccine. So now 3/4 of the population have had at least one vaccine, so when you actually look, we are better protected. Plus you have all the people that have been infected and have natural immunity. So that's where the numbers get skewed. So we shouldn't be complacent. It's still circulating, but we're better protected because of vaccination and because of natural immunity, because a lot of people have been infected. And as has been reported, we've pushed up to 1 million deaths in the country, and it's not over yet. So this is still a pandemic, although we're hoping the trend continues with all of the numbers that you've already heard. But we're still not out of this yet, and we still have to be vigilant.
Thank you, Larry, for the question. And we have another one on Facebook, maybe a quick answer. We have about 15 minutes left, so we're going to have to do fast and furious here. The question is, I just got my second booster to Pfizer. Is there data that shows how long it will be effective?
It would be expected potentially 3 to 6 months that the antibodies, if it follows what the first booster does. That's the long answer. The short answer is time will tell.
Yes, that's true. Thank you, Dr. Lewis. All right, we're going to go to Surprise. In Surprise, we have Rosemary. Rosemary, can you hear us?
Yes, I can. Thank you. And
Go ahead.
thank you for what AARP does for the seniors. I appreciate that very much.
Thank you.
The lady answered the question very well about what goes on in nursing homes, and I suspect what also goes on in independent or assisted living facilities. But what about the people coming to visit them? I know my kids, my son and daughter-in-law, are not vaccinated, nor are my 2 grandchildren. I will not let them come and visit me because it's not fair to the other residents that live there.
Yes.
I can wear a mask, and I can be somewhat protected, and I can wear an KN95 mask and be more protected than the other mask. But, do the people at the front desk card the people and ask them for the immunization information? Because I know in this state, a lot of people only have 1 vaccination, some have 2 vaccinations, some are not boosted at all. Mm-hmm. And that's everybody, every age.
Your points are well taken, and many of the facilities have policies and procedures, and those include, if you remember at the peak, our assisted living facilities, nursing homes were shut down. Nobody got in. So if you wanted to see grandma or grandpa, you're at a window standing outside and could talk through there. And I witnessed that with my own family. And, on a cell phone, doing FaceTime across a brick wall and a window. But today, what most facilities have is policy that would first tell you, if you're coughing, sneezing, don't feel well, don't come here today. Number 2, we don't want you to come in unless you're fully vaccinated and you have proof of that vaccination and you wear a mask, okay? And if there's any question, usually they don't want you to come in. Now, there's options too, because even in these locations where the senior is mobile, you could go to an outdoor area and be 10 feet apart or 20 feet apart and still see grandma and grandpa. So there are some innovative things that you can do to still get close, but you don't want to get too close that to your point, that are going to inadvertently hurt your family member, also anybody else in that facility.
Thank you so much for the question. All right, next one, we are going to Dewey, and in Dewey we have Randy. Randy, can you hear us?
Yeah, I'm here.
Go ahead, please.
Okay. I'm 66 years old. I just received my first booster on January 22nd of this year. And I've read where wait 4 months, wait 6 months for the second booster. But what is the time limit for it?
The CDC's recommendation is it's a minimum of 4 months after that first booster that you can get the second booster.
Okay, so 4 months.
And it's changing. Yeah, it's changed based on whether it was the first. Anyway, for the first booster, there were some changing recommendations, but for the second booster, it's at least 4 months.
Excellent. Thank you so much for your question there. We're going to Sun Lakes. In Sun Lakes, we have Roberta. Roberta, can you hear us?
Yes, I can.
Go ahead, please.
Okay. Part of my questions was already answered in terms of your recommending the second booster. However, that means that if it's only, and they also mentioned that wasn't as effective as the other one. At least that's what I heard on the news. So does that mean, of course, that we're going to have to somewhere down the line get another booster, in the early fall? Or should I actually wait to take this second booster a little further in a couple of months from now?
Okay, great question.
Well, I'll start. I think, again, I don't have your exact timeline, but generally, as Karen said, if you received your last dose 4 months or more ago, you should go ahead and get a booster and not delay waiting for something in the fall, because the recommendations may continue changing as more science is unearthed, and we may find out until we get a formal vaccine that we can define that maybe every 4 or 6 months people will have to get boosters. That's a definite possibility right now. Or until there's no traceability and we have achieved herd immunity, that's a majority of the people are immunized, then you might relax a little more. But I would say get your booster as soon as it's available to you, and keep getting them. And if you have unique challenges and you're not sure, speak to your healthcare provider. Speak to your nurse practitioner, physician's assistant, doctor, and get the information firsthand that's in relation to any unique situation you may have. But in general, everybody should get the boosters at that 4 month period, or after you've gotten your initial one.
Thank you, Roberta, for the question. This time we're going to go to Tempe. In Tempe, we have Arturo. Arturo, can you hear us?
Yes, I can.
Please go ahead with
thank
your
you. Yes, I'm 81 years old. I had my first 2 doses in January and February of last year. I had a booster in September, and I got COVID in January. And then 3 weeks ago, I had 2 stents implanted in my right coronary artery. Question is, when would it be safe or prudent to have my second booster?
So when did you have your COVID?
In January of this year. In
January,
middle of January of this year, yes.
The CDC says at least 3 months after a COVID infection, you can go ahead and get a booster. So when you're stable, it sounds like you're stable, you would fit into the category of saying, yes, you can get that second booster.
All right. Thank you very much. Thank you.
You're welcome.
Thank you. Thank you, Arturo, for your question, and we wish you the best after surgery. This time we're going to go to Gilbert, and in Gilbert we have James. James, can you hear us?
That's you. I don't know how you do this.
Hello?
I didn't, you're on mute.
Hi, James. Go ahead with your question.
Okay. I'm getting ready to travel. And my concern is the outer clothes that you wear and your hair. This virus, does it, how long is that, does it mutate and stay on your clothes? When I get home or into the location where I am, should I change the clothes, wash them? Does this virus continue to live in the clothing and in your hair?
Great question.
Okay.
So the virus, there's a lot of information about how and where the virus lives, and a lot of it depends on the surface that it lands on. A wet surface, a dry surface, a hot surface, a cold surface, and different kind of clothes. So when you're out, if you're in a large crowd, you got a mask on, not a bad idea to change your clothes. I don't think, Karen, correct me if I'm wrong, I don't know of any policy for that. But again, depending on what your degree of exposure might be, that's something you might consider. But the virus can last on hard surfaces with the right temperature for at least a few days. So that's why we wipe down, the surfaces. When you get on the plane, you take your wipe down the seats, wipe down the tray table, wash your hands, as Karen said, as many times as you can, wipe as much as you can, because the virus can live for a little while. But the virus cannot grow and replicate, what they call divide, without getting into your body and taking your cells and your cells' machinery, the food, all of the chemicals in there, because it can't live on its own. So it's desperately trying to get in somebody's body to live, and if it can't get there in time, it dies outside.
The highest quantity of virus is in the saliva, and so that's why you just avoid saliva of other people and protect, the virus from touching your mouth, your eyes, and masks are very protective in that way. If someone coughed on you and you had wet saliva on your clothes, I definitely change. But most of the transmission is from saliva going, and as you talk, there's little pieces of saliva coming out of your mouth that you expose people to. So if you're close to people, you're at risk. If you're touching surfaces and touching your eyes, surfaces that somebody has coughed on, you can get infected that way. So just good infection, make sure you're immunized, good infection control, and you'll have a good chance of being protected.
Thank you, Dr. Lewis, and thanks for the question. We may have time for two quick questions. We're going to go to Tucson. Sharon there has a question. Maybe Carla can help with this question. So go ahead, Sharon. Can you hear us?
If we have received an authorization code.
Sharon, can you hear us?
Get that.
Can't hear her.
I'm not
Sharon,
hearing
can you hear us? No, I guess, actually, the question that she had, Carla, was she wants to know where she can get vaccine boosters in Tucson.
Sure. So a great place to look out for is within our vaccine finder on the AZDHS, azhealth.gov website. We have an interactive map finder that includes information, and it includes pharmacy locations, county health departments, or other similar providers and other healthcare providers who are available. And that way you can identify their hours of operation and find the location nearest to you.
Okay, excellent. We also had another question from Tucson. Donna was basically asking a similar question, where to get the booster shots in Tucson other than the pharmacy. So I think you've addressed that question as well. So thank you so much. Let me see if we have time for one more here. Actually, we're going to go to Mesa. In Mesa, we have Jan. Jan, can you hear us?
Yes, I can. Are you able to hear me?
Yes, we can hear you. Go ahead.
Okay, well, my original question has already been answered, but I have an additional question, and that is, when we have a border problem, right, in Arizona, and a lot of illegals coming across, when they are taken into custody and released later into the country, are they being given the vaccinations to prevent additional spread?
When vaccine is given, there are no questions as to citizenship. So that, yes, they would be available. People who come to this country who aren't citizens still can go ahead and get COVID vaccines.
Thank you, Dr. Lewis. Dana, we're almost out of time, so I'm going to turn it back to you. Thank you so much.
Great. Thank you, Alex. This has been a very informative discussion, and thanks to each of you for asking your questions and answering the questions. And thank you to our AARP members, volunteers, listeners for participating in this discussion. AARP is a nonprofit, nonpartisan organization with a membership, and we have been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them to protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced can be found at aarp.org/coronavirus or the Arizona Department of Health website at www.azdhs.gov. Go there if you have questions that was not answered, and you'll find the latest updates as well as information created specifically for older adults and family caregivers. We hope you learned something and that you can keep and you and your loved ones healthy. Thank you and have a great day, and thanks for participating in this call, and this concludes the call. Thank you.